A rainy day or a streak of bad luck might make anyone feel sad, but eventually the clouds clear and you move on. Clinical depression operates under different rules. It is a medical disorder that leaves a person motionless, unable to react or escape regardless of their circumstances. This visualization illustrates the density of the condition in the United States, where nearly 10% of adults struggle with it. Globally, depression ranks as the leading cause of disability. Before we begin, if you're interested in psychology, human behavior, and powerful life lessons, make sure to like this video and subscribe to the channel. Now let's begin. The root of society's confusion comes down to language. The word depressed is frequently used to describe predictable reactions to life setbacks, like getting a bad grade, losing a job, or having an argument. Equating those temporary reactions to true clinical depression obscures the reality of the illness. Unlike a physical wound, the symptoms of this condition are entirely intangible to an outside observer. Because there are no visible marks, the illness remains deeply misunderstood. According to the National Institute of Mental Health, the average person suffering from a mental illness waits over 10 years before asking for help. Treating a systemic medical crisis as a normal passing emotion creates a significant blind spot in public health. This leaves millions of people trapped in silence simply because the people around them assume they are having a bad day. Clinical depression is defined by strict medical boundaries. Unlike situational sadness, the symptoms must linger persistently for at least 2 consecutive weeks. The diagnosis also requires a severe level of functional impairment. The condition actively paralyzes a person's ability to work, to play, or to love. This matrix shows the standard psychiatric guidelines used by doctors to identify the disorder. To qualify for a clinical diagnosis, a patient must exhibit at least 5 of these specific concurrent symptoms. Those behavioral symptoms include a chronically low mood, severe changes in sleep or appetite, crushing guilt, and a total loss of energy. The criteria also factor in the most severe indicator of all, recurrent thoughts of suicide, establishing the life or death stakes of the illness. Crossing this specific diagnostic threshold marks the transition into a systemic medical disorder. At this point, the symptoms move beyond temporary emotions and require medical intervention. Depression has tangible physical manifestations inside the human body. Looking at this cross-section of a human brain, we can observe macroscopic anatomical changes. The illness is associated with smaller frontal lobes and shrinking hippocampal volumes. On a microscopic level, we find an abnormal transmission and severe depletion of vital neurotransmitters. Particles like serotonin and dopamine fail to cross the synaptic gap in normal volumes. These brain changes are accompanied by severe hormonal abnormalities throughout the rest of the body, such as the deregulation of cortisol. A complex interaction of genetics and environmental factors triggers this internal biological chaos. Yet, the patient looks normal on the outside. There are no physical scars to show the damage. When society tells sufferers to just get over it, it weaponizes the invisible nature of the illness against the patient. The expectation that they should be able to simply decide to be well creates intense shame. The 10-year delay in seeking help is a direct result of a biological illness being trapped behind a wall of psychological guilt and societal stigma. Despite the severity of these biological changes, the condition is highly treatable. Medical interventions can physically repair a patient's brain chemistry. Standard options like medications and therapy complement each other, while specialized treatments like transcranial magnetic stimulation offer powerful alternatives for extreme cases. If you are supporting someone with a diagnosis, never compare their struggle to a normal time you felt sad. Doing so minimizes their biological reality and induces more guilt. Instead, treat the illness exactly like you would a broken arm or an asthma attack. Offer tangible assistance. Help them look up local therapists or write down a list of questions to ask their doctor. And while it might feel counterintuitive, openly asking someone if they are having suicidal thoughts actually reduces their risk of suicide. You aren't planting the idea, you are giving them permission to speak about it. Direct, open conversations systematically erode societal stigma. Removing that shame makes it easier for patients to seek treatment, which allows scientists to learn more about the condition and develop better cures. If this video helped you understand people a little better, make sure to leave a like and subscribe for more psychology insights. Your support helps this channel grow and allows me to create more videos like this. See you in the next one. Remember, understanding people is powerful, but understanding yourself is life-changing.